Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. Well, today is Casual Friday, so what better topic than to talk about travel during pregnancy or vacation. So certainly the most important thing is to, before you make your plans, discuss this topic with your provider, because there are some general guidelines, but those can vary significantly depending on your particular risk factors and your clinical circumstance. So some general rules of thumb are: don't travel after 36 weeks, and usually the middle of the pregnancy, the mid-trimester, is when you're most comfortable to travel. In the beginning, you might have some nausea, you might not feel so well, you're tired, you're weak, so it may not be fun to travel, even if it isn't really a risk to travel. And near the end of pregnancy, after 28 weeks, you get more tired, more uncomfortable. So even if there's a window where it's okay to travel, you may not enjoy yourself as much. So the middle of pregnancy is a pretty good time to be planning on that. Also, when you travel, plan on things taking longer and take your time. For example, I always tell patients, when you're driving, if you have a long extended trip and it normally takes 8 hours, to plan on 10 hours. I really want you to drink lots of fluids, get up, move around, take bathroom breaks. You should be planning to stop every hour to take a bathroom break. If you don't have to go to the bathroom, you're probably not drinking enough fluids. Could push it to 2 hours, but try to plan every 1 to 2 hours. Get up, move around, walk around a little bit. So when you're pregnant, you have slightly risk of blood clots in your legs called deep vein thrombosis, DVT. You can go to your lungs, called a pulmonary embolism. That's low risk, but again, that's where you talk to your provider to see whether you have a higher risk for that. For example, not moving too much, being overweight, having diabetes, being a smoker, having high blood pressure. There's all kinds of complicated things that change your risk factors. But moving around really helps, and it's the lack of movement for extended period of times that increases that risk. Also with flying as well, try to get an aisle seat so you can get up and back and forth and get to the bathroom. And make sure you check with your airlines. Airlines have restrictions. Those restrictions are different for travel in the US and travel in foreign countries. Generally 36 weeks is the limit for airlines, but you need to check, and earlier, significantly earlier for international travel. Cruise ships as well have their own travel restrictions, and again, you need to be looking at your risk factors. Are you at higher risk for preterm delivery? Have you delivered earlier before? Do you have a problem with your cervix called incompetent cervix? If you don't know what that is, that's again a topic that you need to be talking to your healthcare provider about. I'll also consider small traveling and small excursions and outings that could be of risk as well. It's now coming to the summer season here, and one of the activities that sometimes creates issues is going to watch sports events like an outdoor soccer tournament. It's hot out there and you don't want to miss your child. You want to watch, and you get hot, you get dehydrated, you can go into labor. So maybe even a half hour away could be, if you're near time for delivery, could be an opportunity for you to go into labor, end up delivering at a hospital with staff who you don't know, you're not familiar with, okay? And also planning ahead with your travel. If you're stuck far away and you're earlier, if you're at risk for preterm delivery, let's say you deliver out of state, you are at risk perhaps to be out of network with your insurance. If you deliver and your baby goes into the NICU, the intensive care unit, it can be a huge cost. And if you're out of network, it can be devastating. Doesn't happen too often, but I've seen it, and some couples have had to declare bankruptcy. So keep that in mind, really be safe. That being said, break, some travel is good under the right circumstances. Bring your sunscreen, cover up. One of the things that contributes a lot to stretch marks is sun exposure. So I hope you found this helpful, and I hope you take the most important message home from this video is this is a question for you that really will you may get a vastly different answer than what I'm telling you now based upon your own personal circumstances. So plan ahead and talk to your support team. Thank you.